That pause is not the first for elective surgeries, and local doctors are worried about the effect it could have on patients.
News 3's Madeline Parker joins us live in studio now with more on the spike in local hospitalizations. Good evening, Madeline.
Julie, Mark, good evening. Omicron is showing milder cases of COVID and people are less likely to be hospitalized with this variant. But the transmission rates are so high with this variant, hospitalization rates are still going to go up. Now, Omicron made up 4% of COVID cases in southern Illinois just 2 weeks ago. Now it makes up over 80% of cases according to SIH. But the IDPH says Omicron makes up just 30% of statewide COVID cases. To help prepare for the hospitalizations that will come with rising cases, hospitals need more beds to properly care for patients. This is not the first time elective surgeries have been postponed, but the backlog of elective procedures is a cause for concern for doctors.
Hate that we've gotten back here locally. There's already a massive backlog of elective procedures in Southern Illinois, and we're going to create even more of a backlog by shutting down the elective procedures for now. But again, if somebody comes to your door with COVID pneumonia, they can't breathe, you can't say we don't have a nurse for you because the nurse is down working on somebody to get a colonoscopy.
Now, doctors also want to emphasize having a mild case of COVID does not mean it will be easy. That is just the general term for not being severe enough to be in the hospital. Now, doctors are trying to keep hospital patients to a minimum, but if you have COVID, doctors say a good indicator that you should seek treatment is when you become short of breath. Live in studio, Madeline Parker, News 3.